business that's a Hazel business and has been here, what, since 2008?
Yeah.
And they provide home health care, hospital health care, hospice health care. They go to where the patient is, and we're going to be privileged to have them present what they're about and what kind of excuse me, what kind of support they give to people in need. I'd like to introduce JJ, who is the CEO, and you can, if you would, introduce the rest of your crew.
Of course.
And then you can, probably would be useful because we want to pick up this and we're going to put a presentation on the website so that people in YouTube land can view it. So, JJ, if you would, please.
Thank you so much, George. Hi, again, my name is JJ, and I'm here as the CEO of Meridian Healthcare. This is Brooke. She's our Master's of Social Work. I'm sorry, this is Brooke, our Community Educator. This is Diana, our Master's of Social Worker, and that's Lamari Brayboy III, and he is our COO, Director of Operations over at Healthcare, at Meridian Healthcare. So Meridian Healthcare composes of many services. We've been around the Lake County area, servicing the Haynesville, Waukegan, North Chicago, Lake Zurich areas for over 10 years, providing services directly at home, including occupational therapy, physical therapy, nursing, lab results, durable medical equipment, and most importantly, having liaisons come to your home and make sure that you can navigate through the healthcare field, especially in the comforts of your own home. About 2 years ago, we started up our own palliative and hospice care services. This one is very dear to me because I myself am an occupational therapist by trade. I really wanted to first and foremost destroy the negative connotations that's brought by hospice. Every time anyone hears hospice, they think negative. They think giving up. They think that there's no more hope. I want to change that perspective. I want to make sure that we provide the highest quality of care and that we are not only going into your homes just to treat you, but to become your family members, to help you navigate through this very important moment, whether it's your lives, your family's lives, your daughters, or anyone, your loved ones. I also want to be able to innovate in this field. I want to make sure that once we hit the highest quality of care that we can, that we keep moving forward. We keep striving to research, we keep striving to implement programs, whether it's in communities, facilities, or even directly with our patient care, that we're making sure that we're going above and beyond always. With that as well, thank you so much for the opportunity for letting us come here. Mainly because it allows us to fulfill one of our goals, which is to educate the community, especially in the city, the oldest community, the oldest city in the Lake County, that we are just right off 120 here, and we get to educate you all. And that when you guys learn from us today what we bring to the table, not only Meridian Healthcare, but the services that we provide overall. Whether it's any other hospice, any other home health, us bringing this and making you aware of the availability is what we want to accomplish here at Meridian Healthcare as well. So I'd like to introduce Lamari, if he wanted to say a few words. And again, thank you so much for this opportunity. And appreciate you all letting us come here and talk.
All right, good morning, everyone.
Good morning.
You guys were able to make it. We've had some worse days, but today looks pretty good to come out, right? So really, I just want to talk to you guys a little more in depth about the services that we've been providing, some of the new services that we provide, like Jay said, with hospice and palliative care, just answering any questions from there that you guys may have in regards to them. So skilled nursing care is something that our home health provides to our patients. So, a lot of times times people think, okay, home health is only if I reside in my home. No, if you have friends that reside in an assisted living facility, a memory care facility, and there's even some skilled care times where home health can come into play, okay? Home health services really take place when an individual is not able to go out and see the physician, or the physician suggests that, you know, it would be more appropriate for the individual to be seen at home instead of going to outpatient therapy. So a lot of therapies take place in the home health care setting. So an occupational therapist comes out to the home, physical therapist comes out to the home, whatever therapy is necessary, they'll come out and kind of gather an understanding of what's necessary and what or how often they should be there. With the palliative and hospice care is relatively the same. So, you know, you can either have it in your home or you can have it in assisted living, skilled care, or etc. As Jay said, there's a lot of negative connotations with hospice as far as, you know, maybe hospice is for when we really get to the end of life, right? Maybe a week or two before an individual is going to pass, that's when hospice comes into play. Has anybody heard that? Yeah. Is that the experiences?
I thought that the Medicare only pays for hospice if it is an end-of-life situation. X amount of time left.
Absolutely. So that's very true. But what is that time limit? Right? What's the time limit for Medicare?
I don't know.
And so that's what we struggle with most often as clinicians, right? Is to try to determine what that time frame really looks like. You know, how many times have we gone to the doctor and he diagnoses one thing and really it turns out to be another? Or he says, you know, if this behavior persists, then it could be imminent, right? But then a lot of times we're able to turn that around, right? So for our patients or any hospice care program, we really want to focus on the overall well-being of care. So sometimes we'll say, you know, hey, this person had a major change in condition, and you know, we feel like hospice services will be appropriate for them. Actually, if you look at the handout that I gave you in that folder, it kind of gives you a narrative of it just has to be a chronic or terminal illness associated with it, or a major change in condition. That can happen, you know, 6 months before. That can happen a year before. We have hospice patients that are on hospice for over 2 years. My longest hospice patient was on hospice for about 4 years, I would say. And that's mostly common within the dementia memory care sector, that you see the longer certifications of hospice. But even for those of us who don't have a memory care issue or, you know, a psychological issue when it comes to our terminal illness, it's still very important that we look out and say, hey, you know, maybe I won't pass away, or maybe my loved one won't pass away within, you know, a month's time. But can I see that it's very possible that that happened within a year's time? So people graduate from hospice quite often if they see, or if they progress so much that we can no longer see the transition happening within the first year. Does that make sense? Go ahead.
How were you recommended, from the hospital, or do the people call you directly? How? Because we just, he was hospitalized and they sent him home with their nursing care facility, you know, the one they're affiliated with.
Okay, so yeah, so the question is, how are people referred to hospice? So a lot of times it does come from your PCP, which is your primary care physician, or it just might come from your observation and saying, hey, you know, I think, you know, at the very least, maybe we should have you evaluated for a specific service. A lot of services aren't given by your primary care physician until they're asked for. You know, do you think that this will help? You know, a lot of times, as far as education goes, as Jay says, we're very big into it, because when I started to get into hospice, I quickly found out that when it came to hospice and palliative care, a lot of clinicians did not have a lot of education in returns to it. You know, it's a relatively new concept. This is a concept that was just introduced what, 50, 60 years ago. And at that point, it still wasn't very popular. It didn't become very popular until, the past 3 decades. Go ahead.
Sort of jumped the gun there. I really meant skilled care, but
Oh,
I
skilled
said
care.
that question.
Okay, so yeah, for home health care services, if it's nursing or if it's therapy, then yeah, those referrals, we typically get those from the doctor. However, you can still suggest it. A lot of times we go out, if you say, hey, I really want physical therapy for my husband, you can let us know and we can actually reach out to your primary care physician. But we do need an order from them in order to start the home health care service.
So what he's saying is that you get referred for your PCP to like a home health care agency, and they send you to the one they're affiliated with. If you want to use Meridian or a different one, then you would suggest, what, can I not use yours? Can you give me a referral to give to Meridian Healthcare? Because I would rather use them. We've met them, we know them, or whichever one it is, but that's how you do the referral. You would
Because not just
basically-
refer to who they're familiar with,
Yes.
right? So if the home health care is very, common in their area, or they worked with them in the past, or sometimes it's just as simple as they left a brochure on the desktop, So a lot of times there's no, they don't favor one from another, most times. But a lot of times you'll just find that it's what's most conveniently there.
So to verify your question is why a referral would come is simply because the physician feels like you could benefit from at-home services. So anything that we do at home allows you to gain the ability or maintain the ability to do what you do every day. What we call it in occupational therapies, activities of daily living, which is cooking, cleaning, watching TV. If that's something that you do every day, we make sure that you're able to stay healthy enough to stay in the comforts of your own home and to either maintain or improve what you are want to maintain. Yeah. Does that answer your question?
Was that, yes, go ahead.
Okay, after knee surgery, go to rehab. If you wanted to stay home, would you be price-wise, would they say, hey, this is cheaper, we like that, to have you stay home, or really just rehab cheaper?
To be honest with you, that's not a mindset that I find that most doctors have. They're not thinking of the financial repercussions to you. And if you pose that question to them, a lot of times they won't be able to answer it. It really just depends on what type of insurance plans you're on. There's a lot of managed care plans that are coming into play right now. However, we can speak to, original Medicare, obviously is more accepted as of currently than most managed plans. So if you have original Medicare, your options are a little more open. But that's still catered as far as what co-pays and things like that are going to be affiliated. That's still catered to your Medicare plan, if that makes sense. However, when it comes to outpatient therapy versus having therapy in home, it really depends on how severe, the reasoning is for therapy in the first place. A lot of times within our community, we have a lot of hip fractures, right, or hip breaks. Sometimes that, we suggest that you get your full benefit from a skilled care nursing home so that you have that continuum of therapy all the time, every day. Everything that you do is geared to that. You have that 24 hours, 7 day a week supervision. So it's good to use your benefit if you can for the duration in that skilled care. However, I'm very opposed to skilled care being a long-term care resource. So after you use that and after you feel like you are strong enough, after your therapist feel like you're strong enough and your doctor, then to be discharged home, therapy can continue there. And that's really where home health picks you up at that point. So that, you're not completely healed when you leave skilled care. When you leave skilled care, however, the therapy that you would get however many times a week at home from that PT or OT will help kind of get you to your goal point. And that's the terminology that we kind of use in home health is, we set goals for you. So if there's something specifically that your doctor wants to be done, if it's something specifically that you want to accomplish personally, we create that within your plan of care. That's what we call it, as a goal. And then once we come out, that's what we're looking to meet each and every time. Does that make sense? And then can you scroll up? What do you have on that? Oh, so we talked about therapy, we talked about skilled nursing. That skilled nursing is really, in our community, we find that a lot of people who are bedbound or wheelchair bound have, can accumulate wounds, right? Especially if you had a fall or something to a similar nature. So the skilled care nursing, they take care of a lot of wound care is what we see. However, we do a lot more than just wound care. Typically what I say is we're kind of like a hospital on wheels. We can do x-rays, we can do IVs, we can do blood work, analysis, all types of different things that we can really participate in your home that you can also get from, your primary care physician or hospital. And with palliative and hospice care, we really have to meet that. So, once a person is in palliative care specifically, let's just hit on that really quickly because I don't think that idea, but palliative care is very different from hospice. Palliative care really focuses on symptom management, right? So let's just say you had that fall and you broke your hip and you still are in a chronic pain and your doctor can't manage it, or he's been trying to, and some things help, but it doesn't really give you the quality of life that you want. That's where palliative care really comes into play because we'll really assess, what's the cause of the pain, what would be most helpful. These are doctors and nurses specifically geared to symptom management. So that's pain, that's depression, that's anxiety. If there's a memory care issue, then there's even the psychosocial medication that we look over to see what will best help with that. Does that make sense for palliative care? So it's really just a consulting agent. So people have palliative care that are 30. People have palliative care that are 20. There's a lot of breast cancer survivors or cancer survivors in general that enroll in palliative care because a lot of the medications can be symptomatic and sometimes a lot of still the effects of their condition can be symptomatic. So we kind of, manage that. And you can have that with home health. You can have that with you until you decide not to have it anymore. Okay? So any questions about palliative care? Okay. Well, then I think we'll let Dee hit on social work. Okay.
Hello, I'm Deanna, I'm the social worker. My role with Meridian is to visit. I go on a visit, I check on everybody's mental well-being, make sure the family's doing okay. I work on the hospice and palliative side right now. I don't really dabble too much in home health care yet, but it's a possibility later on. Palliative patients I go and I see once a month, make sure that they have all the resources that they need, like transportation if they can't drive, if they have a fractured hip and they need to go to the doctor. They have medical transportation, they make sure that they have food in their fridge, things like that. Hospice-wise is more in depth. I visit my patients more frequently, probably 2 times a month, sometimes every week, depending on what state their family's in and they're in. I help with end-of-life planning, with cremations and funeral arrangements, and all different kinds of things like that. I help those families as well with community resources because end of life is financially hard. If they have paid caregivers that come into their home, sometimes they need extra community resources to help spread their financials a little bit better across the board with, caregiving, not so much medications, but vitamins, food, things like that. Grief and bereavement is something else that I do. I have a plan of care for bereavement for each individual that it was around the family member that has passed away. I keep up with them a year or more after the person has passed away just to see how the family's coping with it. Birthdays come around, anniversaries come around, holidays come around. All of those can be triggers to remember that loved one that passed away. So I try to call in, check in. I always encourage them to call and check in with me if they ever need to talk to somebody. We'll go out for coffee, we'll go out for food, whatever they need to do to just kind of talk them their way through their loss. I educate caregivers on the what's the word I'm looking for? The progression of the disease as the patient starts to decline throughout their hospice stay with us. And sometimes that's hard to deal with because one day they know who you are, and like a dementia patient, and the next day they're punching you because they have no clue who you are. And it's all part of how it goes. It's very strenuous on a family member to see their mom, not know who they are, or their grandma, who they're super close with, not know who they are. So I do a lot of those kinds of visits, a lot of the hard talks and things like that. But we all get through it, and I've made a lot of nice family members along the way, so it's good. The life planning part goes along with most of the funeral arrangements. Some are open to talking about it and some aren't. They want to plan it the day that the person passes away. So that's what we do. Well, a person will pass away, they'll call hospice, we'll go, and we'll sit for the next 2 hours figuring out which funeral home is going to come, what their service is going to be like, and the day that it's going to be. So I kind of do a little bit of all of that. Any questions? I know I talk really fast, I'm sorry.
Does Medicare cover any of those consultations?
It's all part of the hospice benefit and palliative benefit.
You mentioned transportation. I know there are a bunch of different services like PACE and the Avon Township has a thing. Do you have something when you refer to transportation in addition to those things?
They usually work on like a case-by-case basis, so if I have a patient that fell and fractured their hip, or I have a patient that just can no longer drive and they need to utilize it, a lot of the times they'll give you, like, there's like a little like benefit package where each ride there, that's only $5 or whatever. I just call and I talk to whoever's there and I explain the situation, and then we work together to get it resolved so that person can go where they need to go.
So do you get the monetary benefit or do you make our transportation arrangements as well?
I make the arrangements. I don't do anything with the money. We talk about what they, like their financial income may be or what their fixed income is, and then we go from there. So I'm like the middleman. I do a lot of the talking, a lot of the phone calls, so that way, once I have everything in place, I can go back to my patient and be like, this is what we decided, this is what's gonna work for you, here's your schedule, here's your bus ticket, and it's all right there, put it together in a folder or whatever.
And when you set up transportation, you work with existing things like PACE or, yeah, okay.
And the main thing too, when it comes to the transportation, especially with these new, managed care plans over your Medicare, a lot of them may have a benefit for that transportation. So you might not have to use a specific resource that the city gives you or PACE gives you. A lot of times make sure that you're asking before you enroll or you're enrolling agent for your managed care plan, whether that be Humana, Blue Cross Blue Shield, Aetna, make sure that they have that transportation benefit in there because a lot of them do. And they handle the monetary part, obviously.
They do.
So they're going to they're going to be able to reimburse you or be able to pay for those rides, just so long as it's from one of their selected vendors or what have you.
Always ask if there's a benefit for it. That's going to be my best advice. If you need a service, always ask your managed care. Is there a benefit for this? Because there's a ton of people don't have any idea of this.
But any more questions for Dee? She's a great resource.
I can find it, I promise.
Okay. All right. Thank you, Dean. So before Brooke gets up here, I just want to tell you guys a little bit more about us when it comes to the different resources that we use within the community. One thing that we're currently working on that will hopefully be released in about 2 or 3 weeks from now is just transitioning with dignity, right? So a lot of times it's hard to have the conversation of, hey, when is it time for me to consider, progressing out of the current situation that I'm in? And I'm going to give you a couple of examples of that. For, in early stages of life, we move for different reasons, right? So we first move because maybe we got married, or maybe we had 3 kids instead of the 1 that we were expecting. So we had to move to a bigger home because of that. Or maybe the job was just closer at a different location, so we had to move because of that. The different transitions in life force us to act accordingly, right? So a big resource that I felt that the community needed, because so often we would be asked, at what point should I consider putting my loved one in an assisted living facility? Or when should I consider living in a senior community? Or when should I even consider some of the programs that we offer as far as home health, hospice, or palliative care? So currently we're working on a program that kind of goes into depth of what you can expect with different assisted living facilities, with different memory care facilities, with different skilled care nursing homes. Kind of just to give you a basis of what to expect or what to look for that you might like. So, as Brooke comes up here, she's really going to just go over some of those resources. But if you guys ever have any questions as far as, what place would be best for either I or my loved one to reside, where I don't feel like I'm giving up certain things that I really like, or what questions do I have in regards to what will be provided to me in addition, as far as both the financial benefit of it and the assistance medically or just simply cooking or laundry or what have you. So we're definitely a resource for that. So if you have any questions now or if you have any questions in the future, make sure you give us a call and ask us those questions. How much would it cost for me to move? How much would it cost for me per month? What would I get with that? And so on. Okay, but Brooke is going to go over some of the things that we do with some of the communities that we are in.
So my name is Brooke. I am the community educator with Meridian. My role with Meridian is basically to go out to the community and people like you guys and educate you guys on our services. We can meet for coffee or lunch. We can just meet in your home, and usually it takes about 15 to 20 minutes with any other questions just to explain kind of what we do in terms of healthcare with our communities. Another part of my role is to make sure that our communities are comfortable with what we can do for them. So, not only are we committed to our patients, we're committed to the facilities that they're in. For example, just the other week, I volunteered for a grand opening for an assisted living facility. And we do other events like tea parties and men's corners, just to make sure that everyone there is having a good time, that our patients are comfortable, and that the staff there is really shown that they're appreciated by us because they work so hard to take care of our patients. Another thing that we do is bingo. We do that at Trevance Living, which is just down the street from here, right off of 120. We also offer exercise classes from our occupational therapists to make sure that you guys get your muscles moving and your blood flowing. And anything that we do here, can also be done in your home as well. So if you guys need some extra tips on exercise or anything to make sure that you're up and moving, to make sure that you're not so static, we can do that for you as well. But really my role is just to spread awareness and education about our services. And even if you don't go with us, even if you prefer someone else, that you're aware of everything that they can do for you guys in your home, or if you guys decide to move to another facility. And we just feel that education is so important when it comes to, our community, especially the town that we're based out of it, and you guys, and we want to make sure that you guys know everything that you need to know about your health.
Before we take any more of your time in your meeting, I'd just like to add that we offered a lot of information to you all today. And not 100%, I don't expect you all to understand it or even remember 10% of it. But at the end of the day, what I would really want you guys to remember is to make sure you ask. That's the one thing you should do. A lot of people have, an unknowingness of what's to come ahead. And the best thing that you could do and the first step that you should take is ask. And so you make sure you reach out to us. Make sure that we help you guys navigate, or we could refer to anything, any questions or concerns or services that you guys would prefer, whether it's with us or with someone else. Just ask. Thank you again.
All right. Thank you very much. I appreciate you coming. I do have a couple of questions. Number one, let's let everybody here, as well as in YouTube land, know how to contact you. Do you have a telephone number or something that you can give to, just say.
Oh, just say.
Yeah. We have a website. If you could direct the camera over here, our website is this is our office number. We are available 24/7.
Just so,
The number is 847-543-7550. And you can always access us on the internet at meridianphc@gmail.com, our email, or on our internet website is meridianphcs.com. Definitely.
okay, I have another couple of questions. It's obvious that the things like the healthcare kind of things that you do is covered by insurance. Is there a charge for your community outreach or your educational aspects?
No. I feel like as an agency, education is our goal, and we want to represent that by making sure that education is free. Whatever you guys, any questions that you have, any concerns that you may have, whether it's you or your family members, we will absolutely do a free consultation. We'll absolutely answer your phone and make sure that you are taken care of.
All right, any other questions? Thank you very much, I appreciate the information, and we'll get with you again.
Appreciate it, George. I appreciate everyone here.
All right, thank you.
CJ, I didn't get a folder.
Nancy, do you have an extra folder?
Yes.
That's what I